Diabetes is a big problem, according to American Diabetes Association. So 29.1 million Americans, which is 9.3% population, have the diabetes. It's enough to harm in our society and in our health field. So in today's class, we will only focus on high blood sugar, which is hyperglycemia in diabetes, and how to measure.
And she brought candy for you too.
Yeah. Yeah, here is the handout for everyone. Yeah, I have to do two more things. One is give everyone the handout, and another thing is this student evaluation form. So I assume you already know some of the knowledge about diabetes and the care. Diabetes is metabolic disease. The body cannot produce insulin or cannot produce enough insulin. And this is called high blood glucose in the blood. We call that insulin helps break down sugar in the blood, so the body can use the sugar as fuel, F-U-E-L. There are three main types of diabetes. Type 1 diabetes usually happens in children and young adults. The pancreas produces little insulin or produce no insulin at all. Type 2 diabetes is when the body does not use insulin properly. This is called insulin resistance. Gestational diabetes only happens during pregnancy, so there is an increased need for insulin during pregnancy for mother and baby. But the pancreas, mom's pancreas, cannot keep up with it. Without enough insulin, the cells are not using the glucose, so the blood sugar level get too high. So I had a gestational diabetes when I was pregnant with my son, Wilson, in 2010, about 7 years ago. This, or whether the body cannot produce insulin, cannot produce enough insulin, or cannot use insulin effectively, or a combination of 2 or 3. High blood sugar happens, and it's called hyperglycemia. We are diabetes 1, 2, 3. We are here. So if when it happens, it could cause an increased urine volume, thirst, fatigue, weakness, and an increased chance to get infection. If we don't treat hyperglycemia, a diabetic coma, or ketoacidosis could happen. These are life-threatening conditions which require immediate treatment. Without enough insulin, the body cannot use glucose for fuel. Instead, the body breaks down fat. A large amount of fat waste products called ketones is produced. The body cannot get rid of them all through the urine. So the ketones build up in the blood and cause ketoacidosis. The symptoms here. The symptoms of ketoacidosis are short of breath smells fruity, nausea, vomiting, very dry mouth, dehydration, and the water electrolyte imbalance, and confusion. So of course, we do not want this to happen. So we must monitor blood glucose level and find out the problems as early as possible before it gets worse. Oh, this one. We can share this later. Blood glucose testing is critical for diabetes patients. So let us look at fasting glucose and A1C. Fasting glucose is the blood sugar level after fasting or when the stomach is empty. It's important to check this measure on an empty stomach because sugary food that you eat before the test could impact the result. A normal fasting blood sugar level is less than 100. Pre-diabetes is 100 to 125. Mine is 125. I just did test 2 weeks ago. Diabetes fasting blood sugar level is 126. Additionally, the patient will need to do an oral glucose tolerance test to confirm the diagnosis. The A1C test is measure the patient's average level of blood glucose in the past 3 months. So the normal A1C level is 5.7. Pre-diabetes is 5.7 to 6.4. Mine is 6. Diabetes is over 6.5. So I'm including one case study, which is myself. I was diagnosed with gestational diabetes in 2010 when I was pregnant with my son Wilson. Gestational diabetes affects women during pregnancy. Both mother and the baby will be at risk. So my symptoms was thirst. I had to keep a bottle of water by my side at night because the thirst woke me up frequently. The doctor made a management plan for me and I followed it strictly. The key of this plan is control the blood sugar to prevent problems. Check blood glucose 4 times a day and write the numbers down. It's overwhelming work. It is overwhelming work, but it let me know whether my blood glucose is in a normal range or not. So I can make an adjustment according to my blood glucose level. The adjustment is about diet and exercise. Diet. I didn't need to eat certain special food, but I needed to change what, when, how much I eat. So during my pregnancy, I ate balanced meal and followed a health eating plan. I ate a lot of vegetables, fish, beef, white meat, and I cut down carbs. So in order to control my blood glucose, I wrote down everything I ate and keep track of my weight. Well, right now, I is 105 pounds. So, carbs come from certain food, starchy food such as bread, potatoes, noodles, that immediately convert to sugar in the body. I also had to avoid candy. Candy and sugary food or snack. I cannot eat those. Yeah, exercise is very, very, very important in diabetes management. It helps the body use insulin better and helps control the blood glucose level. Walking and swimming are the proper low-impact exercise for pregnant women. I didn't put it here. So the last one is regular checkup for mother and baby. This is for the gestational diabetes. Make sure both of them are healthy. With exercise and diet, most of the time I could control my blood glucose at a normal range. I didn't need any medication to control blood glucose. I had a C-section. After the surgery, my blood glucose went very high, and the doctor gave me insulin to control it. My son's blood glucose was being monitored too. I monitored my A1C level in every 6 months since 2010. So it runs between 6 to 7. So do you remember the A1C level here? So I monitored it every 6 months. I still need to eat right and exercise because I'm at risk for type 2 diabetes. So next, how to measure blood glucose. I got this for everyone. The first one, wash your hands. Always wash our hands. This is mine. I have the meter. The second one, insert test strip into this small machine. So it will turn on by itself. The third one, use the needle, punch the side of fingertip while outside because it's not as painful as here. So the side, you punch it. First, put a drop of blood on the test strip and wait. It will give you the number. Wait for the result. So you can look at this after the presentation. So when you test blood glucose for a patient, you need to be sure this is the right patient. We have a video. You can watch it later again. This is basically what I did. Here is the machine if you want to look. Yeah, I did this for my whole pregnancy, 4 times a day.
How much did your baby weigh?